Approximately 29 million people suffer from diabetes. I'm guessing that's 29 million in America alone?
That's right.
Okay, America alone. It's the leading cause of blindness, amputations, heart disease, and renal failure. Medicine can slow things down, but a new therapy can actually stop the diabetes and reverse the damage. Back with details, please welcome Dr. Stanley Lewis, Medical Director of Diabetes Relief.
Good to be back.
I think the reason why diabetes is so confusing to a lot of people is because it causes so many different problems in the body. Heart disease, as I mentioned, amputations, renal failure. It is kind of an umbrella for a lot of things, isn't it?
Absolutely. But before we go into that, I want to make a couple of things clear that sort of held over from the previous segment.
Yeah.
I don't want folks to walk away thinking that diabetes is only because you eat the wrong things.
Right.
Because there is certainly a genetic component.
And sometimes how your body deals with food, right?
Yes.
Just how your body deals with food.
And that's sort of what we've discovered at Diabetes Relief, which, by the way, is not a cure for diabetes, but can reverse some of the complications of diabetes when it's done in conjunction with medication, traditional medication.
I have a couple of friends who are thin. They're thin. And people go, you have type 2 diabetes? They do. So it's not a weight issue with them.
Exactly. And so what we found is really the root cause of diabetes is a failure of the metabolism. And actually that occurs well before you develop the symptoms of hyperglycemia or high sugar.
Yeah, so when you have the failure of the metabolism system, then the weight gets gained. It just keeps gaining and keep gaining.
And then you start gaining weight. So you're not actually diabetic because you've gained weight. You've gained weight because your metabolism failed, and then the end result was your pancreas waving the white flag saying, hey, I can't metabolize all that you've ingested, and now you're going to have high sugars.
Yeah. Now, the conventional way of dealing with it, we know people oftentimes talk about taking insulin, taking other types of things. Of course, high blood pressure becomes an issue, and all that stuff, cholesterol as well. So they take the medications. So the thing they need to understand is that the medications alone are not necessarily going to stop everything or cure anything.
No. In fact, we try to focus on a more holistic approach. Certainly, we do encourage patients to continue taking their medications, although on our treatment, a lot of times they're able to come off of several medications.
Because you're not treating symptoms, you're treating the root cause.
Because we're treating the root cause.
Okay, let's go to the root cause here.
Yes. So what we do at Diabetes Relief is we've recognized that the pancreas and the liver communicate. And they communicate through a vessel called the portal vein. Pancreas senses how much sugar is in the blood, and the liver, in response to the release of insulin, is able to dispense hormones, enzymes that are responsible for metabolizing all the food. What we found in diabetics who have inflammation, who may be overweight, etc., that communication is broken down.
Yeah,
it doesn't work.
Then the organs start shutting down.
And then the organs start shutting down. It's like the pancreas needs to speak to the liver, but the liver can't hear the message that's coming from the pancreas.
Without getting too scientific, how do you all do that? You deliver this through a transfusion system, right?
Yes, so we have an infusion technique that we use at our clinic that restores that communication between the pancreas and the liver. And I oftentimes liken it to if you meet someone that doesn't speak English, one of your go-to ways of trying to communicate is to speak slower and louder.
Yeah.
But that doesn't help.
Where is the bathroom?
Exactly. And in a lot of ways, that's what we're doing with our medications, right? So we're just making the pancreas excrete more and more insulin. But that's just like speaking louder. It's still not speaking the language that the liver needs to hear.
Okay.
Well, at Diabetes Relief, we mimic that language. We restore the more physiologic communication between the pancreas and the liver so that the liver can operate more optimally.
Yeah, I'm just going to take this one example. Vicki Lee, she was diabetic, hypertensive, and had retinopathy, neuropathy, and end-stage renal disease. So basically, her kidneys are failing, her eyesight was going, everything is going south. She was on dialysis 5 times a week, doing that as well. She had no energy, and she said it was painful to just walk. Really, what was happening here, she was dying.
Yes, she was dying.
All right.
And Vicky's really a special patient of ours. We're really excited, and we really wish she could be here with us today, but she's painfully shy.
Good morning, Vicky.
Good morning, Vicky.
No, what is she probably on a shopping spree or something? Because now she can do this, right? Because after treatment, what is she like?
Oh, she has gotten so much better. For instance, her dialysis, which was 5 times a week in the doctor's office, is now 4 times a week at home,
So things are starting to reverse.
Right. She was on dialysis for 3 hours at per session. Now she's only on for 2.5. She's visiting her retina specialist half as often as she was before. Her endocrinologist has reduced her insulin 5 times since she started our treatment. And the most impressive thing, though, for patients is she's gotten her life back. I mean, she's gotten her energy back. She wasn't able to play with her grandkids or even do housework because she was so fatigued. Now she is wearing heels.
Yeah. Oh, wow. All right. And then you have other folks who were scheduled to get amputations, because we know diabetes is the #1 reason for amputations, who were able to not have that issue because their wounds were able to heal.
Yes, and we're going to talk about that the next time you invite us back to the show.
Okay, that was a teaser.
That was a teaser because, yes, we're actually opening our new location in the Woodlands with foot and ankle specialists there. And wound care specialists, because they've recognized, as we've recognized, that this is one of the best ways to enhance the wound healing in patients who have diabetes.
You have people coming from around the country to get treatment here, and so you're opening them as fast as you can.
All around the country. Yeah. We have folks that travel from many thousands of miles away to get this treatment.
To get well. All right. Dr. Lewis, thank you very much. Schedule your consultation, and you can receive a free bottle of Metabolic Enhancer. And be sure to mention Great Day Houston when you call. That Metabolic Enhancer, what does that do?
Oh, that actually helps in between times. So we talk about some of the micronutrients that you need that our bodies are depleted of. So this really helps with nutrition.
All right. For more information on diabetes relief, call this number. It's 281-600-5000. 281-600-5000, or log on to diabetesrelief.com. Coming up, there's